Rhinitis just means inflammation of the nose. So when we talk about allergic rhinitis, we are talking about inflammation of the nose that is caused by what we refer to as an allergic response. The other terminology that we use for allergic rhinitis is hay fever, and those two terms, they are synonymous and they mean the same thing. Allergy is more like a hypersensitive condition, and what that means is that if somebody gets exposed to certain things in the environment that are not harmful to majority of people in this world, then people with allergy, their body will react in such a way that they will develop a disease, and I'm going to explain this. Now, you might have two individuals, and one probably is allergic to pollen from a certain plant. So when they both get exposed, one would not have any symptoms, but one will develop symptoms suggestive of nasal inflammation. For one to develop an allergic condition, then we look at two factors that are the genetic factors and the environmental factors. Now, you'll always see, like, sometimes allergic conditions like rhinitis, allergic conditions such as asthma, allergic conditions such as eczema, they run in families, and that is because of the genetic component. So sometimes we say, for example, if both parents have got some forms of allergic diseases, then the chances of the children getting the same conditions are very high. And also sometimes if one parent has and the other parent does not have, again the chances are there, but not as much. So for you to develop an allergic condition, you must be genetically predisposed. Now, that does not mean that all people who are genetically predisposed that they're going to develop the condition, because again, we know this is the role of the environment. And the environment, again, there are many factors that have been talked about, things like the kind of foods we eat, things like the kind of life we lead when we're young, things like even the pollution we see a lot in the urban centers. So there's always that interplay between the environment and the genetics. Now, for us to say that you have a genetic condition, for us to say that you have an allergic condition, it means that your body is more sensitive to otherwise harmless things in the environment. The example is, we might go to a place, maybe like 10 people go to a place, maybe to a room that has a dusty carpet, and 9 out of 10, they have no problems. But 1 out of those 10 people will start having a running nose, an itching nose, a sneezing nose, and within a few hours, the nose gets clogged up. Then that person, then we would say he has some allergic rhinitis or some form of allergy to the nose. But that does not mean that the dust is a bad thing, because all of us have been exposed, but it's only one person who has developed a condition from that exposure. So to have an allergic condition, it just means that your body is sensitive to that substance. Another example is, like, let's look at food allergies. We all eat almost the same kind of foods. Millions of people today, they are going to eat eggs or they're going to take cow milk. And you realize we all take cow milk and we are okay, we are fine with it. But there are certain individuals in the population, if they take cow milk, they develop reactions that are harmful to their body just by the fact that their body is sensitive to those proteins in the cow milk. So that is what we would say is an allergic condition. And we shall talk about the various substances that are very common in causing this allergic rhinitis. So what normally happens is that once the patient or once the person gets exposed, in a matter of minutes, like even less than 10 minutes, the first symptoms they're going to develop is sneezing, running nose, irritation of the nose. And sometimes you might also have irritation of the eyes. Then a few hours later, then the same patient will develop worsening of these symptoms even after they have moved away from that area or from that place where they got exposed. They're going to develop other symptoms, and the major symptom they're going to develop 6-8 hours later is blockage of the nose. Then with the blockage again, the nose will keep on running, and initially the mucus may have been very light, they will start becoming a little bit thicker and a little bit more mucoid. And the other symptoms we talked about, loss of the sense of smell, headaches, they will also now come in this patient. There are quite a number of triggers to allergic rhinitis, and the best way to look at them is to look at the indoor triggers and the outdoor triggers. Now, the indoor triggers include things like house dust mite. Then when we talk about house dust mite, we are talking about small, tiny organisms that live in the dust, especially the dust that we get in the bedroom. And all beds or all bedrooms in this world, regardless of where you live, they contain the house dust mites, and you can't see them with the naked eye. And it is the droppings from these house dust mites that some people develop allergy to, and they get symptoms of allergic rhinitis. And what we know today is that the commonest indoor trigger is the house dust mite, and we shall talk about how to control this house dust mite later. The other common indoor trigger are molds. Molds, they also grow in the houses, especially in wet, damp areas, places like in the bathroom. You get a lot of molds that grow there. Or sometimes when you have ceilings that are leaking, or you have some taps in the house that are leaking, then that could form a very fertile ground for molds to grow. And there are people we know, once they breathe the air containing these molds, then they develop symptoms of allergic rhinitis. As we get increasingly urbanized, then we see also a lot of people with allergies to cockroaches. And with cockroaches, we know that when the cockroaches die, when they're decomposing and their skins are breaking up, the proteins there and also saliva and droppings from the cockroaches, they have also been known to cause allergies in certain people. Another common indoor trigger is what we call animal dander, or maybe the fur or the skin from cats and dogs. And we see those people, and sometimes it becomes very difficult to convince somebody that the cat really is the cause of their problem. We also now talk about outdoor triggers, and the commonest outdoor trigger is pollen. Now, for pollen, we know we have many plants that produce pollen, from weeds, from grasses to trees. Important to notice that the very colorful flowers or pollen from very colorful flowers usually does not cause allergies, but is only pollen probably from the not so good looking flowers or from the grasses and the weeds that causes a lot of allergy related conditions in the nose and sometimes also in the chest. The treatment options for allergic rhinitis, since we've looked at the causes, I think what most people need to know is that the most important thing when it comes to treatment is to avoid the trigger. And if, for example, we know that the trigger for your allergy is caused by a cat, then the only way out is to get rid of the cat. Or if you know that your trigger is house dust mites, then you need to take measures to reduce exposure to that house dust or to the house dust mites. Again, you look at the trigger, control the trigger, and we call that allergen avoidance or lifestyle modifications. So that basically is your first step in the management of these conditions. Now, after having managed the triggers, then the second level of management is to use medications. And there are many medications that we use to manage this condition. And these medications can be given by the form of syrups or tablets. They can also be given in the form of nasal sprays, and they can be given in many other ways. But again, these should be given in consultation with a physician or with your doctor. To reduce contact with the allergens or with the triggers, I think the commonest trigger, as we said earlier, is the house dust mite. Now, how do we reduce this? We reduce exposure to house dust mite first by reducing the amount of house dust in our bedrooms. How do we do that? First, we make sure we have no carpet in the bedroom. Secondly, we make sure that all the surfaces in the bedroom or all the surfaces in the house whereby dust can settle, they are always dusted. And you don't need to buy some fancy vacuum cleaners to get rid of this dust. Even something like a wet mop or wet rag is good enough to clear this dust from the wardrobes, from the cupboards, from the bookshelves, from the curtain boxes, from anywhere. We just make sure that that bedroom or that house does not have dust. And now it becomes difficult for the patient with allergy to do the dusting. So we would tell somebody to make sure they get somebody who does that for them. Then during the daytime, we also recommend that the curtains should be drawn open, and also the windows should be opened to allow proper ventilation and proper circulation of air, and if possible to allow direct sunlight to get into the bedroom, because again, studies have shown that direct sunlight or the UV light, it helps in killing of the house dust mites. The other strategy that we can have to reduce this is to make sure, for example, you don't use blankets because they also gather a lot of dust, and we would recommend patients to use cotton sheets or even duvets because they are easier to handle, they are easier to clean, and they don't gather as much dust as the blankets. And we would also tell patients to make sure when they wash their bed sheets to make sure that first they soak them in hot water for about 20 to 30 minutes, again because this has been shown to be very effective in the killing of the house dust mites. Now, these are simple things that somebody can do and they don't cost much to get rid of dust, to wash your sheets, to open the windows, etc. Sometimes in the market we have some what we call house dust proof bed covers or house dust proof pillowcases or mattress covers. They are expensive, but again, they've been shown to be very effective also in the control of exposure to the house dust mites. I think if somebody could control the house dust mites in their house, then by and large, over 70 to 80% of the triggers or of the triggers will be sorted out. The other triggers, things like molds, again, is to make sure that in the house you don't have any wet, damp areas. To make sure, for example, if there are any pipes that are leaking, they need to be repaired. If the drainage of water in the bedroom is not very good, it needs to be sorted out. If there are any ceilings that are leaking, again, they need to be sorted out. And sometimes you see people with a lot of potted flowers in the houses, and every time in those potted flowers, you'll always put some water and probably some dry leaves or mulching. Then again, you can have molds that grow in those pots, and therefore sometimes we'd advise people to get rid of those potted flowers that are indoors. Control of cockroaches, again, it's obvious. There are many ways to exterminate them. Then if somebody has got cockroaches in their house, they also need maybe to consult the experts who can help them to eradicate them or to use the appropriate insecticides. Things like cats and dogs, again, it becomes a problem, especially with the children or with the owner of the pet when you tell them to get rid of the pet. But again, with proper education and with a lot of understanding from us, then we are able to convince the patient that getting rid of this pet will sort out your problems. So basically, control of these triggers is not expensive, does not require resources, and it just requires an understanding between us and the patient, and just to make sure the patient understands that getting rid of this or doing this is going to sort out most of your problems.